Anthem, Blue Cross Blue Shield, and Northern Light Health have still not reached a new contract agreement, but negotiations are ongoing. The contract extension both sides agreed to expired Saturday, meaning Northern Light Health's non-hospital facilities and healthcare professionals are now out of network for Anthem members. However, Northern Light Health CEO issued a statement over the weekend saying even though there was not an agreement, Anthem customers would continue to be treated and billed as in-network while negotiations were ongoing. In a statement yesterday, Anthem disputed that claim. They say that statement from Northern Light is a recipe for patient confusion and incorrect charges to patients. Northern Light released a clarification statement sent to us this morning, and it says Northern Light Health continues to work through mediation with Anthem to reach a new contract. Until we reach a final decision, we will be holding all bills for any patient care that has occurred outside of our final contract date of Friday, October 31st. Patients with Anthem insurance plans will not be billed for any services until the completion of this negotiation. In the event an agreement is reached, we will ensure the contract is retroactive so that any care provided during this period will be billed at in-network rates. They add they remain committed to serving all in the state of Maine who need us, and we continue to work closely with Anthem to conclude negotiations as soon as possible. Medicare members and Northern Light hospitals remain in-network until December 31st.